What's up, AP Psych? Welcome back. You have officially made it to your final video of mental disorders, which will cover schizophrenia, which is now the schizophrenic spectrum disorder with the update of the DSM-5. After this, we'll have a couple videos for therapies and different types of psychotherapies to help and aid in treatment of these disorders. And then we'll be moving on to our last topic of the year. So let's hop right into schizophrenia. So an important part and piece to know about schizophrenia, first off, is what psychosis is, right? So psychosis is a symptom, not an illness, in which thought and emotions are so impaired that contact is lost with external reality, right? So psychosis is a symptom of schizophrenia, right? It's not the actual illness, but you lose contact with your external reality. And like I just mentioned, schizophrenia is now on a spectrum to encompass the many and varying degrees of symptoms a person can have and still be identified as schizophrenic. Okay, so there's several different disorders, but for our sake, we're going to focus mostly on schizophrenia itself. So schizophrenia, when we talked about depression being the common cold of psychological disorders, if depression is the common cold, then schizophrenia is the cancer. It impacts roughly 24 million people, or 1 in 300 people worldwide. That rate jumps up to 1 in 222 people when we're talking about adults only. This strikes young people as they mature into adults. Their symptoms usually begin to appear between the ages of 18 to 20, and for males, and 20 to 30 for females. Okay? And it impacts men and women equally around the world. It is a worldwide disease. So some of these symptoms of schizophrenia. The translation of schizophrenia is literally split mind. Okay? So when we talk about differentiating dissociative identity disorder and schizophrenia, which are oftentimes for some reason confused, and if you have a dissociative state, you have a break in your personality. Right? If you're suffering from schizophrenia, you have a break from reality. And that would be something I'd write down or add to your notes. Dissociation is a break from personality. Schizophrenia is a break from reality. You have to split from reality. And it's characterized by a few things, which we'll go over each one individually as well as we continue. Disorganized and delusional thinking, disturbed perceptions, which we'll term hallucinations, and inappropriate emotions and actions. Okay, so those are the three big characteristics of a schizophrenic patient. So first up, disorganized and delusional thinking. Here's a quote from a schizophrenic patient in 1982. She said, "This morning when I was at Hillside Hospital, I was making a movie. I was surrounded by movie stars. I'm Mary Poppins. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday." Okay, and if you're reading that thinking none of that makes sense, that's the perfect example of delusional thinking that you're Mary Poppins, but also disorganized thought and speech, in which you can't regulate what's popping up in your mind. And so you're moving from topic to topic to the point where it doesn't make sense. Okay. So many psychologists believe that this disorganized thoughts occur because of a lack of selective attention in these patients. Okay, so that results in fragmented, bizarre thoughts that spill out in no particular order because they can't control what they're thinking and how it processes through their minds. In addition to those delusional thoughts, you have disturbed perceptions. And this is when a schizophrenic person may perceive things that are not there, hallucinations. We'll get into that a little bit more in a second. But they also have inappropriate emotions and actions. And emotions are inappropriate to the situation. Their actions are inappropriate to the situation. For example, a schizophrenic patient may laugh at the news of someone dying or potentially show no emotion at all. And that's referred to flat affect or apathy. Right? They just show no emotion. They're unmoved by it when they should be, or they should react appropriately in an emotional way. So we're going to talk about positive symptoms first. And when we talk about psychology, I want to remind us what positive and negative means. It doesn't mean good and bad. Positive, just like in learning, positive reinforcement and negative reinforcement, positive punishment, negative punishment. Positive means the addition of something. Negative means the subtraction or absence of something. So a positive symptom in schizophrenia is distortion or excess of normal functions, and tend to be the most frequent in the first stages or early episodes of schizophrenia. So you're adding to your normal functions, things that should not be there. So for example, delusions, hallucinations, disordered speech, and disorganized behavior are all positive symptoms, additions to your normal functioning that are impacting your day-to-day life. So first up, delusions. These are distorted, false beliefs about yourself or others. So these delusions are usually persecution. Someone's out to get me. That's the paranoid aspect that many schizophrenics encounter. Or grandeur, believing you're Superman, or believing you're Mary Poppins, and you truly believe you have these thoughts, these delusions, these false beliefs about other people or yourself. Hallucinations. This is the perception without the corresponding sensation. So you have no sensational information coming into your senses. There's no stimulation there, but you're still experiencing some type of perception. Okay? So frequently these hallucinations are auditory. You hear things, you hear voices in your head, right? You hear someone speaking to you. Less often, they could be olfactory. You smell something that isn't actually there. Gustatory, taste something that isn't actually on your tongue. But most often, schizophrenics hear voices that make insulting statements or give orders of some kind. For example, Son of Sam down here, it's a famous serial killer. He admitted and he said that he murdered people because his neighbor's dog was the devil and he was telling him to do it. Right? So not only are there delusions there with those disordered thoughts and beliefs, but also hallucinations of the neighbor's dog speaking to him and telling him what to do. So disordered speech coming up next is another positive symptom. It's also known as word salad. These disordered thoughts lead to often jumbled words that seem to make no sense to the listener. We've talked about word salad before when we talked about Broca's aphasia, but while it may come out similarly, these are caused by the disordered thoughts or the hallucinations that you may be experiencing as a schizophrenic. Disordered behavior is our final positive symptom, and patients with schizophrenia often have motor behaviors that are inappropriate, so certain tics or certain things that they consistently do. The individual may perform senseless, compulsive acts like continually rubbing their arm or rocking back and forth in a chair. Something like that is a positive symptom of schizophrenia. Okay, now we move on to negative symptoms, and just like we mentioned earlier, negative would be missing or subtracting from your normal functions. So you have a lack of functioning than what you normally should. So these include flat affect. People might avoid eye contact. They have expressionless faces. They're apathetic, non-interested, monotone voices. That's flat affect. Almost like you have no personality. You have no interest in anything. Poverty of speech, long lapses, slowed down speech, trouble processing, a lack of directness, slow movements, little interest in social participation. So these people are very removed from society, they're removed from interaction, and they seem to have no emotional connection to anything. So there's chronic and acute schizophrenia when we talk about these two. And when schizophrenia is slow to develop, it's a chronic process over time. Recovery oftentimes is doubtful from this. It takes a long time to develop, so it's hard to overcome. Such schizophrenics usually display negative symptoms. Those negative symptoms are harder to overcome. These negative symptoms of flat affect, poverty of speech, lack of directedness, oftentimes it's harder to treat and harder to come back from. On the flip side, if you have a schizophrenic or a break from reality that rapidly develops, or it's called acute or reactive, recoveries are much better for that. Treatment is much more effective. They usually show positive symptoms, and psychotherapies have a much greater rate of success when treating these positive symptoms rather than trying to overcome the negative symptoms or the chronic process of schizophrenic development. So to help us understand schizophrenia a little bit and where it comes from, it's a disease of the brain exhibited in the symptoms of the mind. So what does that mean? Well, we know that there's a huge link to dopamine overactivity in the brain, and researchers have found that schizophrenic patients express higher levels of dopamine D4 receptors in the brain. So if a dopamine overload, which we've talked about when we talked about biological psychology and all of these neurotransmitters, an oversupply of dopamine is linked to schizophrenia. Also, there's some abnormal brain activity in the frontal cortex, the thalamus, and the amygdala, right? Our decision-making and planning center of our brain, the area that directs all of our sensory information. as well as our emotional centers, which makes sense that these areas are impacted by schizophrenia. That also, adolescent schizophrenic patients show brain lesions or destruction in certain areas of the brain. Some additional abnormal brain morphology. Schizophrenic patients may express morphological changes in the brain, like the enlargement of fluid-filled ventricles. One of the biggest correlations is someone with no schizophrenia, this ventricle in the center of your brain, which is usually filled with fluid, is much smaller in a non-schizophrenic patient compared to one with schizophrenia. So that's an easy or an identifiable brain marker when looking into diagnosing schizophrenia. Some additional things about brain anatomy. We talked about the frontal lobe, the frontal cortex. There's abnormally low activity there. Your decision-making, planning, personality centers. Hallucinations, there's too much activity in the thalamus, right? Your sensory switchboard is malfunctioning in some way, and it's causing issues with, auditory hallucinations, visual hallucinations, gustatory, olfactory, right? It's not directing your sensory information in the correct way. There's greater shrinkage of the hippocampus, your memory centers and higher level functioning center, and the amygdala, which are your fear and emotional centers, which make the disorder worse. In addition, if your thalamus is small, the greater difficulty in filtering information and possibly reacting in the correct manner, again, because it's not being able to direct your sensory information correctly or efficiently enough. So why do these brain abnormalities occur in the first place? There's a few correlations that have been shown. Low birth weight can have an impact on these and brain structures and their development. Birth complications, lack of oxygen, things like that. In birth, infections that the mother has during pregnancy, a large correlation with flu during the third trimester of pregnancy has been connected to schizophrenia and the development of schizophrenia. Some genetic factors. The likelihood of individuals suffering from schizophrenia is 50% if their identical twins have the disease. So this is showing that schizophrenia has a genetic link and is highly heritable. But this is not to say that identical twins have a higher likelihood of developing schizophrenia. It's just showing you the genetic link. If you are an identical twin and your identical twin has schizophrenia, you are 50% more likely to also develop schizophrenia. You can see those links across cultures of the world down here. Okay. Some early warning signs of schizophrenia include several things: a mother's own long-lasting history of schizophrenia, birth complications, which we mentioned earlier, oxygen deprivation and low birth weight, short attention span and poor muscle coordination, disruptive and withdrawn behavior, emotional unpredictability, and poor peer relations and solo play. So if you are recognizing these symptoms and saying, well, that sounds like a lot of the other disorders that we've discussed, that could be ADHD, that could be a personality disorder, it could be several different things, right? That's the hard part about diagnosing schizophrenia early on, and it makes it difficult to get children help if they do have early onset schizophrenia. So this in general wraps up our schizophrenia notes. We'll talk about some things in class, and we'll go over some examples and differentiate it again from DID, just in case any of you are confusing those two. And we'll go from there. So please let me know if you have any questions.